I'm Angie from Smart Clinic. Welcome along. Today we're going to be looking at 7 key questions for you to ask, which will help you to find the right occupational health provider for your organisation. So the first is price. We're going to go straight in with the big one. So we know that price is important and you need to ensure that you aren't being overcharged. However, it's also really important to remember that a cheap occupational health service that performs badly for you will cost you so much more than an expensive one that performs well. A bad occupational health service will cause you problems by not answering questions properly, giving bad advice, arranging unnecessary reviews, and of course, regurgitating what the employee says, including their list of demands to their employer without any independent medical advice. By contrast, a good occupational health service will provide you everything you need first time and straight away. So definitely don't make your decision purely based on price. However, we also know that more expensive doesn't necessarily mean better. So look for a provider that balances a fair price with an exceptional service. You should also look for a company who are completely open with their pricing structure, have no hidden costs. At Smart Clinic, we publish all our prices on our website, and what you see is what you get. There's no hidden costs, no variation in pricing for some clients over others, and certainly no unjustifiably high prices. So moving on to number 2 is the turnaround speed. So with occupational health, the chances are that if you have referred a member of staff to the service, there's a degree of urgency. So timescale is important, and from the outset, you should have in writing what the provider's predicted timescales are for appointment availability and report turnaround time. And if the provider isn't willing to guarantee these timescales, look elsewhere, because if the service is too late, then it's meaningless. It may even cause you more damage than not using the service at all. It's also worth checking what the appointment availability is like. How much choice will the provider be able to give you for appointments? When can these be expected? How does the member of staff book their appointment? Speed is of the essence. So moving on to number 3 now, length of appointment. When you're looking for a detailed occupational health report, this will also require a detailed assessment from your occupational health company. So if it's a race against the clock for the nurse or doctor, detail will suffer. A good consultation will need to cover a full health history, including any background that isn't covered within the referral. Any health issues they've had previously in their life may or may not be relevant, but our clinicians need to discuss this to form their own view. We'll need to understand the social context, such as someone's home life, professional life, how they commute to work, and what support they have from friends and family. We'll also need to explore the reason for the referral with the employee, including any current presenting health concerns and issues at work. And finally, we'll need to discuss any advice we may have for them, as well as giving them an overview of what we will be including within their occupational health report, and provide them with an opportunity to ask any questions they may have. So, if you're considering a provider who allocated 45 minutes or an hour per appointment, see this as a big red flag. That isn't long enough, and you will either get a lousy report or an additional bill for more time. At Smart Clinic, for example, we allocate up to 2 hours per appointment of our occupational health advisors. Next, number 4, in-house versus outsourced? Are your clinicians directly employed or do you use a network? Such a simple question that will give you great insight into how your new occupational health provider will operate. If your occupational health company uses a network of occupational health advisors, then they're using the same clinicians as every other business who works that way. You aren't getting anything unique or different. Occupational health providers who employ their own clinicians have been able to carefully select the right people for the job, train them exactly on their procedures, ensure that they're working consistently with the company's professional standards, and have a robust audit and quality control process in place. For exactly this reason, at Smart Clinic, we believe in employing staff directly and avoiding networks wherever possible. It's one of the key ways that we maintain a good quality service. Next, number 5, the quality of the advice. A key challenge with occupational health providers is reports with low quality advice. This may mean just repeating what the employee has said, offering no independent medical opinion, telling the employer what they already know, avoiding direct answers to questions, and sometimes even reports which are littered with mistakes. This is a much trickier one to work out in the procurement process, because you will never properly know what the quality of the advice is going to be like until you have actually used the service 3 or 4 times. But there are 2 key ways that you can check this out during procurement. Firstly, ask for copies of previous anonymous reports and see what you think. Secondly, and more importantly, ensure that the company can provide you with an ad hoc service which involves no commitment from you. This means you can try the service out, see what you think, and form your own view of it. If the service isn't right for you, you can move on to a new provider with no penalty. A company that won't offer you this flexibility may just have something to hide. So next we have number 6 question, which is portal and systems. These days a portal or client area feels like a must, but believe it or not, there are still plenty of companies out there who make you do referrals on paper or on a Word document, then emailing them in. Quite apart from the huge security risk that this brings, it's also administratively much clumsier for both you and the occupational health provider. So finding a company with a great portal that's easy to use, has great features, is so important. After all, so much of your interaction with the provider will be via your portal, so it needs to be user-friendly. You should always ask for a demonstration of the portal before signing up. Better still, if the provider will let you trial the service for a while, you can log in and try it out for yourself. Finally, number 7 is customer service and feedback. This last one seems obvious, but the customer service you receive needs to be tip-top. That means different things to different people. You may be looking for fast responses, helpful advice, or friendly representatives. You may be looking for a dedicated team to contact in the event of you having any questions. In any event, you're going to want to do some independent research on this yourself. So take a look at some of the public feedback from the organisation that you're looking at. Some clients will ask for references or testimonials from existing clients. Now this is a good start, but just remember, an OH provider isn't going to give you the contact details for an unhappy client, are they? So try looking at a few independent review sites like Trustpilot or Google to see what others have to say. Companies like us can't control the conversation, so some of the comments can be quite revealing. So that's our 7 tips on what to look out for when selecting an occupational health provider. We hope this has given you a little food for thought and helps you to ask some of the right questions. That's all for now. Thanks for watching.